Welcome to the January Policy Forum. This is for those of you that are new, this is a meeting we have once a month on the last Wednesday of the month at 2 o'clock, and we talk 2 o'clock Eastern. We talk policy. Most often it's federal policy. We also dive into state policy from time to time. But this forum really is to keep you up to speed with what we're doing as a policy team at FASD United, invite you to join us with things that you can do to help support moving FASD related legislation forward, and to hopefully educate you a little bit so that as you're reaching out in your own states to create change and do advocacy, you've got some more information to help you out. We anticipated that we might have a slightly smaller crowd today because it's January and things have not quite gotten going yet. But we do have quite a bit of information to share with you, and feel free to use the chat box along the way. For any of you that don't know me, and it's hard for me to believe that at this point, but my name is Jen Wisdahl, and I am lucky enough to be working in policy at FASD United. I come to this as a mom. I'm mom to 3 kids with FASD. Well, I say kids, but 13, 16, and 20. So this is a cause very near and dear to my heart. I work at FASD United, but I work from Washington State. So I'm bi-coastal, and my phone number is plastered all over this presentation, as is my email. I do answer my phone, and I do my best to keep up on email. So if you have any questions after this, feel free to reach out. Feel free to give me a shout, and I'll try as best I can to answer your questions, or at least send you to somebody who might know. My partner in crime on this is Susan Shepard Carlson. And for those of you that don't know Susan, she is the former First Lady of Minnesota, a retired juvenile court judge, which is where she got involved in that intersection with FASD when she was in Minnesota, and founded what became Proof Alliance. So she's been doing this for about 2.5 decades and really has been the guide behind this, and has recently taken over as the FASD United board chair. So I'm very happy to have her leading the organization in more ways than one. That's kind of an update on who we are. I want to introduce you to my colleague, Susan Ellsworth, and Susan is runs our affiliate program, and Susan can give you a little update on what's going on with the affiliate.
Good afternoon, everybody. I also work for FASD United. I'm not quite bi-coastal. I operate out of Indiana, where our homestead is. And so if you see me do a sudden head jerk today or put my finger in front of my lips, it's because our kids had an unexpected snow day. And I'm giving them the, hey, I'm quiet down mode. Our affiliate network is across the country from coast to coast. It's made up of organizations and agencies that have their own particular focus. They all are autonomous and they have their specialties. So we've been so fortunate to have a diversity within our affiliate network, from those that specialize in policy or research, training, support. We have some agencies that have clinicians and are actually doing some diagnosing. And so if you are come in contact with a group of people who are passionate about FASD or neurodiversity, pass on my name and my email to them, and we'd love to chat about them, how they can join the affiliate network here for FASD United.
Susan. So the FASD Respect Act, and again, I'm going to do just a quick dive back because we do have some new folks joining us, and it's kind of the worst thing ever when you join a group and they've already moved on to step C when you're still learning step A. So we just want to kind of get everybody up to the same place. The FASD Respect Act was introduced in the 117th Congress back in 2021, and it was comprehensive legislation looking at FASD. So looking at supporting and continuing the 50+ years of research that have been going on about FASD, continuing the programs that support prevention and surveillance efforts at the CDC. But most importantly, this legislation addressed what hasn't been addressed legislatively in the US, support and intervention for people living with FASD. We've had 50 years of research, we have lots of prevention activities, we have lots of surveillance activities, not necessarily enough, but we have it. What hasn't existed is that baseline level of support for families like yours, families like mine, and people living with a disability. So it was a 60 some odd page bill, a big comprehensive bill. And I don't know that anybody expected us to make as much traction with it as we did. And that is really due to the work of so many people on this call. We were able to take that bill further than any other legislation had been in the last 20+ years. And legislation's been introduced every year for FASD since the 90s. With the exception of the 115th Congress. So taking it as far as we did this last legislative session is pretty big, because it's shown legislators that we are a force to be reckoned with, even if we didn't get it passed. So looking forward into the 118th, we still need to address a little bit about what happened. So at the end of the year, the 117th was a pretty tumultuous Congress. There was a lot going on. We got to the end of the legislative session, and they agreed to language in the Health Committee, the Health, Education, Labor, and Pensions Committee in the Senate. The language was agreed upon by Senate leadership in a bipartisan way, and they were hotlining the bill. I'll explain what hotlining is on this next slide here. And one senator said, I have more questions that need to be answered before I could say yes to this bill. And that ran out the timer, and we weren't able to get the bill passed. And it was pretty devastating. I was pretty upset about that. But I think we have a good game plan moving forward to get things to where we need them to be. And I'm just checking the chat, and please do let me know if there are any questions that come up there. Although I do appreciate the weather report.
One of the things that I wanted to say about policy too, because this came up during all of our advocacy. This was really reauthorizing legislation, because there have been funding from Congress beginning authorized in 1998, and all of that authorization language had expired. And so the Respect Act, really said to Congress, you made that determination back in 1998 that this was an important issue, and now you've let that expired. And so that really helped in some of our advocacy. I think it's important to remember that this is something that they did do, and they let it expire, and it's even more urgent now because we know much more about the disability than we knew when you originally authorized it. So I just wanted to put that out there.
So going into January, and those of you who are with us in our policy forum in December, we laid out, here's the work that we need to get done. We've gotten through some of it. Unfortunately, we've had some slowdowns because we don't yet know. Hopefully we will know by Friday who's on what committee. They just announced, I think it was yesterday, Susan, that they'd come to an agreement on numbers on committee. How many members of each party were going to be on each committee. And now they're going to go through the task of assigning committee staff or assigning committee members. And from there, we'll know who the committee staff is as well. And so all of these pieces come together to be able to inform who we're reaching out to and how. So we have had partial debriefs with our Senate and House champion staffs. We haven't been able to connect with all of them yet. And so that is still a work in progress. We know that our lead sponsors, they're very committed to this cause. Klobuchar and Murkowski, McCollum, very committed. We are going to need to search for and find a new lead author in the House because our lead author passed away last legislative session. We have started the process of having them review the bill language, working on meeting with appropriations staff, because part of this is getting the legislation through. The other piece is getting it funded and getting funding attached to it. And then we've started the process of dividing the bill up if we need to for committee specific legislation. And then all of that is going to need to be put together into the policy website with some new materials. So it's all kind of work in progress on that. We do have some new staff in our lead authors offices, which means we need to get them up to speed and briefed on the issue. To a point where they're comfortable talking about it and they're comfortable using their political capital in addition to their boss's political capital to move things forward. We really need our lead authors offices to be champions for this cause, and we can only do that by educating them and making sure that they understand the depth and breadth of this issue too. So,
and I just want to add, I just want to stress, we're not starting over. And it's not the intent of the lead sponsors that we start over with where we were, 2 years ago. We're going to, and this is what the intent is, do a fast track in both the House and Senate. And that's, if you see down below where it says to do, I know last time I said we don't have to worry about Lee because then we're going to do a majority, but lead sponsors, we have made so much inroads. They want to do the emergency the hotline process in the Senate, and because all the senators had agreed to that except for one. So we need to strategically reach out and address those specific issues that his staff person had. And I have to stress it was the staff person. And one of the things that we've learned a lot of times is that the member, if you get a hold of the member, they're more likely to support something. It's the staff that can be a roadblock. So I just want to assure people that that's their intent. They want to move on this quickly. And maybe I've gone ahead of some of our slides, John. I apologize.
that is utterly your prerogative, Susan.
Oh,
Go for it. All right. So here's the plan. Yeah. So the plan is that we will, and this is in collaboration with our lead authors offices, this is what they're recommending at this point, is that we go forward with Respect Act 2.0. And that will contain the language, the priority language that was agreed to by the HELP committee. So Senator Burr, Senator Murray, both of whom are no longer on the HELP committee, agreed to bipartisan language from the FASD Respect Act that they would put through on a hotline. That we knew it contained the Building FASD State and Tribal Systems section and the Center for Excellence section of the bill. But it would be a pared down version of the Respect Act. Act. So it wouldn't contain all the bells and whistles that the 66-page bill contained. And some of that is a little bit strategic because while the 66-page bill was very inclusive and well written and had all the pieces that we needed to address in there, it also spanned multiple committees. And that is a challenge to get put through. It was very long. Legislative staffers have limited time. Getting them to read a 66-page bill, understand it, digest it, and act on it when this is maybe the first time they're ever hearing about FASD, it's also a little bit of a challenge. We've done a great job in educating our staffers and our legislators' offices so far. So I don't know that that's necessarily a barrier now, but this is kind of the mindset in checking in with our lead sponsors and our champions in the House and Senate. This is kind of the direction they said that, given the lay of the land, this is probably the best way to go this legislative session. So they are preferring to hotline in the Senate. And that appears as though that's not going to be an issue with Senator Sanders of Vermont, who is now the chair of the Senate Help Committee. He took Patty Murray's place in chairing the Help Committee. But we are going to need some outreach to Senator Cassidy of Louisiana, who is the ranking Republican. So this is, a little bit of our work cut out for us here. Priority 2 would be to either at the same time or post Respect Act 2.0, introduce an education bill that addresses the education issues that were in the Respect Act. They go through the same committee in the Senate, Health, Education, Labor, and Pensions, but in the House, they go through the Labor Ed committee. So we want to try and find sponsors and champions that are on that committee that can help shepherd it through, because that really does help to have your lead authors either be on committee or be connected to committee to be able to get that through. And then the third priority, and I say it's the third priority, I'm not saying it's a lesser priority, it's just we have 3 priorities at this moment, is then the justice pieces of the bill, and looking at introducing a justice specific bill, because that, again, that's covered by a completely separate committees. So dividing that up a little bit. Draft language is in progress on the education bill and the justice bill. Respect Act 2.0, we know kind of our work that we need to do on our end to get that piece moving forward. But that's kind of the overall big scope. Sid had asked in the chat, Susan, will there be specific sections on child welfare and plans of safe care? Do you want to address that?
Yeah, and I was just going to do that in the chat. Sid, and I'm glad you asked that, because I've been going through and looking at a lot of the HHS language, and I think that's an area that really there needs to be specific language, but I think we're going to need to look and see when they do. They did not reauthorize the that had been amended last Congress by the Senate, and it passed the committee, but it didn't get through Congress. So we need to circle back with Senator Murray's bill, I believe. And I liked what they did with regard to how they changed the definition from diagnosed with an FASD to, I think the language was affected by drugs and alcohol, and that's a whole nother. But I think that's one area that really didn't get reauthorized from Jillian. Yeah, that's what that was my understanding. So it's not in the bill. There's a lot of language that will help provide funding for training in child welfare, and I know that the Centers for Disease Control and the Administration of Children and Families is working on some stuff having to do with that, but it's there at the top of our list to figure out how best to get involved in that particular part of that issue. So I don't know if that's helpful, but that's what we know.
So looking at the priority help language, this is what we know that was agreed to last legislative session. Again, this may change. I know the first thing that comes out of everybody's mouth when they hear we've got proposed language is, well, can I see it? Can you send it to me? Guaranteed, if we mention proposed language, I get 40 emails asking for it. So I just want to preface this with, this is what we have so far. This may change based on feedback from Legislative Council. This may change based on feedback from our legislative champions, the people who are introducing this. So again, this is not something that we ourselves as FASD United wrote saying this is the solution for everybody. This is what was agreed to in the help committee.
Well, and I do want to say that when you look at the language, it's really hard to tell how, because they actually took the code on FASD programming and amended that. So it's really hard to tell from that exactly. So I went and did that, but until we get everything through Legislative Council, it's like, we're not, I don't think it'd be good for you to have that to go to members of Congress until we have something that's agreed upon by the lead sponsors.
It just gives you a good idea of what's going on.
Yeah, and this is very general. I mean, there's nothing in here that's, and that's a lot of times with the legislation. One of the things I like to be more specific with language, but I've learned that they don't want to be very prescriptive, and so a lot of it they put language in so that it could relate to a lot, you don't have to prescribe it, but there's funding to do in that area. So like you look at educational programs targeting professional and systems of care. So that could be education, it could be child welfare, it could be health professionals. I mean, and so I think until we know exactly, and this is all health and human services. So if you see research, would not be with the research that we know of it through the National Institute of Alcohol Abuse and Alcoholism, although they did change the name of that. That's changed now. Maybe Sid knows, or Jillian. That's kind of a policy wonk thing. They did some destigmatizing in some of the names having to do with alcohol abuse. But it does contain this, and I think this is really important for advocates. It does contain the building state and tribal capacity, which I think is, to me, transformative for the field, because I mean, you can have silos of programs in the federal government, you can have silos of funding in state government, but unless you have, that bridge that really looks at what you're doing, and building that capacity, because there's a lot of programs. In some of the times when I'm bored, I'll read through the funding bills, and there's a lot of funding that goes to lots of programs where you think it would cover FASD, and it doesn't. And it's like, well, if we could just take 1/10 of 1% of that funding and infuse FASD into that, and that's kind of the information a lot like Senator Lee's staff would like to have, because they say, well, what are they going to do with it? But it's beginning to look at this, that states and federal government have to look at it more in a systemic, holistic way. And that's one provision Senator Murkowski, that provision has been in every bill that she's introduced since the language expired in 2007, I believe. So that's going to remain. I can guarantee you that.
And this will be part of Respect Act 2.0. Okay, so this is the Murkowski-Klobuchar. I see, Kathy, you're talking about tribal systems, so you need a lead sponsor. That's this is intended to be all part of the FASD Building State and Tribal Systems section that was in the Respect Act originally. That's the end. Chris, can you really quickly grab the passcode for switching to a phone call and throw that in the chat? Thank you. So the next piece of the agreed upon help language was the Centers for Excellence and bringing back the FASD Center for Excellence and bringing it back really as a place to disseminate all of this research, because we've had 50 plus years of research, but what happens is, unfortunately, the research gets done and then we move on to the next piece of research, but that knowledge translation piece of getting that research into practice doesn't happen. And that's where the Centers for Excellence would come in. So we know that piece is intended to be in Respect Act 2.0. We may come up with another name for it, but I kind of like the FASD Respect Act, and 2.0 I think helps differentiate it from the efforts we had in the last legislative session.
Jen, are you talking about in the bill itself or just what we're calling it?
Just what we're calling it for now, but I think that's really up to the lead authors what we call it. Yeah.
Well, I know that the language, if I recall right, they did keep respect, FASD respect,
which is good.
Which is good
because that's what we need. But these two sections really talk about building capacity in states. So building, specifically diagnostic capacity, screening capacity, training capacity. So these are all the sections that refer to supporting people living with FASD.
And I do need, one of the things also that they include were recommendations that the National Task Force had in their report back in 2009 also. So there's, it's like you charge an entity to tell you what to do, and then you don't do it. So now that's what we're doing.
So how you can help at this point, because I know that, so much of this work that got done in the last legislative session honestly came from all of you. And I know many of you are ready to take a break on a beach somewhere because you did so much work on the Respect Act last legislative session. And some of you are kind of really keen to get going. And so the big thing right now would be researching your legislators and their staff. Know who they are, know where they went to school, know what their legislative priorities are. Do they tend to lean more fiscally conservative? What kinds of things are they concerned about when, so we know to talk to those points when we speak to them. There was a really great article, and I know we're going to be putting out some information and some materials around this shortly on, they looked at storytelling with legislators and what was effective versus what was not effective. They did a study on this, and telling your legislators how bad things are, you would think would make a difference for them wanting to make things better. But what they found instead is that you have to really talk to their priorities and tie your pain points into their priorities in order to get things done. That's the most effective way of doing things. So getting to know them and about them and what drives them is important. Calling their offices and finding out who handles healthcare policy. You can also find out who handles justice and education. because those are the people, those are the staffers we're going to want to meet with, and they play musical chairs all the time. So just because you knew who was working on your legislative priorities last session doesn't mean they'll be there anymore. We've had a lot of turnover even within our legislative champions with their staff, and we'll have to educate them and get them up to speed just like their predecessors. The other thing you can do, and we found we had a lot of success where states got together, and sometimes it was through an organization. Other times it was through groups of organizations working together. Other times it was through a ragtag group of parents getting together around a kitchen table. All of these were highly effective in getting their legislators on board in their states. I look at states like Kansas, I look at Texas, California, Hawaii, Maine, the groups where people pooled their resources and worked together as opposed to separately in getting their legislators on board are those states that had the most success. And it doesn't have to be formally through an organization. It can be. Colorado does a great job with advocacy and getting everybody together on advocacy. The point is, doing this alone, we don't have as much power. Banding together, we do. And so I really would strongly recommend finding out, connecting with other people in your state and talking about this. We connect with other people in our areas, or we connect with other people online in the Facebook groups or whatever, all the time as parents and caregivers and as people living with FASD. So making those connections include the policy work, include talking about what we're going to do to get our legislators to pass meaningful legislation, can and should be part of that conversation. Some of the big areas of help, and the reason I put this up here is initially when we started working on the FASD Respect Act, the most legislative sponsors we'd ever had, and you've heard me say this before, was 9. In 20 plus years, the most we ever got to was 9. This last legislative session, we had 74 in the House and 10 in the Senate. 9 total versus 74 in the House, 10 in the Senate. That's pretty good. And how we started was we would reach out to these little groups in each state. We'd reach out to the affiliates, or if there wasn't an affiliate, we'd reach out to a parent group, or we'd reach out to a foster care group, or any group that was working in the space of FASD. And I'd meet with them and talk about, here's what's going on with the FASD Respect Act, and here's how you can help. Here's how you can get involved. Not just writing a letter to your legislator, but here's how we can do some meaningful work to get them up to speed and hopefully get something passed. So the states that we're really missing that piece in are listed on the screen here. And I'm not saying there aren't people in those states working really hard at supporting FASD. What I am saying is, if we look at those states, those are states that we could probably use a little bit more help. Right. And that doesn't mean that states that aren't on that list don't need more help. I look at our friend Melissa in Georgia. She's got a good group of people working around and supporting her, but not nearly enough. She could use some extra people coming on board to reach out to their legislators in the state of Georgia. So it really is networking, building connections, and making FASD legislation become a part of this conversation. If I look at, and this is from October, so things changed a little bit after October with legislators being added on. But if we look at like the meetings we had in the House and the co-sponsors we had in the House, you can see some big blank spots on the map, right? So these are areas that we really need to focus on in order to be able to kind of cover the country with FASD advocacy. And that's really, we've got 50 states. It's been 50 years since FASD was discovered. I think we can get 50 states on board. So that's my goal, at least with this year. And looking at the Senate, same thing. We have similar gaps And again, this is from October, so we did have some additions subsequent to that. I just didn't have time to redo the whole map. My apologies. But, you know, looking at this, if you have connections in these areas, you don't need to even reach out to them yourself. If you want to send a connecting email between them and me, I am happy to take that meeting, reach out to them, give them materials, go through how to advocate, you know, do that advocacy 101. If you have a group in your state and you have new members who have joined that group and you'd like to have a refresher for that advocacy 101, and here's how you do the meetings and here's how you set things up, I'm happy to do that as well. Now, for some of the states that have the big advocacy coalitions, you know, I'm looking at you, California, Texas, you know, what we did find out, what we did get later in the legislative session was we were able to get a list of all the legislative staffers that have handled healthcare policy. And that was really helpful for setting meetings. That is something that we intend to do again this year. I just haven't been able to get that information yet because they're still playing musical chairs. So once the dust settles a little bit, then we'll go ahead and get that list out. So there was a question in the chat about there being a way to figure out why legislators did not agree to co-sponsorship or if they were ever contacted. And we did do what I hoped was a valiant effort at keeping up on the website, having who we've met with and who we didn't. And unfortunately, fortunately, there were so many meetings, it was just really hard to keep the website updated with who we met with and who we didn't. I would say with the exception of about 2 legislators that said, no, we're not going to support this because it's going to cost money. We didn't get any, no, absolutely not, we're not going to do this. What we got were, oh, okay, I'll take it to my boss and we'll think about it. So even if a legislator's been met with before, most times we met with staff, and staff turns over pretty regularly. So I would recommend that even if, you know, that particular legislator's office has been met with before, we meet with them again. And we talk to them again about, you know, here's what's different between this year and last year, or, hey, you're new to FASD, you're new to this role. And this is where finding out the background and history of the staffer you're meeting with, the staffer that covers healthcare policy, and the legislator really is almost more helpful than knowing if we've met with them in the past or not.
Yeah. Well, and I just want to say on point, Nebraska, and he's a moderate Republican, which they're a rare breed. Representative Bacon all of a sudden shows up as a sponsor, and we had not had a meeting and didn't, and as you can see, we didn't have any advocates there. Well, I'm Googling, I saw him on an interview and I thought, well, he sounds like he's because we have a divided Congress. And so, you know, that's a reality and that's how we're going to have to deal with it. And I thought, well, he would be a good part of the problem solvers caucus and bridging the divide. And so I Googled him, and he is adoptive foster father of, I don't know, 3 kids. And so he must have found out from something out there, and he signed up. And so you don't know. And that's why you need to, you really need to research them out. And he was also on the adoption caucus, I believe. And so those I think are there for a reason that is meaningful to them. And so drawing that connection.
So looking at the House and Senate calendar, I know that on the Senate side, at least, they want to get the bill introduced as quickly as possible and hotlined, and they're working with the House counterparts to find out what process they could do to get that done. Respect Act 2.0, remember that's the shortened language, put through. My hunch is probably March. is kind of my guess and my timeline for that. But you can see the House and Senate calendar here. The other thing I would like you just to pencil in on your calendars, if you're able to, is we will be having a Hill Day, and you know, looking at a virtual component of that. You know, you can always meet virtually. That's how we did the majority of our meetings last year. But Hill Day on September 21st. So set that aside as a day of action. If you want to come to DC and do the Hill Day there, great. We'd love to have you, and support you with that. But if you want to do it remotely too, just set that aside as a day of action. So the other thing, and I just want to put it out there, and Ron Hansen, that might be Barbara or it might be Ron, I'm not sure, because I don't see the screen on, talking about SB 1016 in California. It was Barbara. Hey, Barbara. Talking about SB 1016 getting passed in California. And for those of you that don't know, that was legislation that got FASD as a named condition under other health impaired for special education purposes. But, you know, it talked about, you go through 1,000 contacts and you finally find the right person at the right time. And what I would say to that is, going back to, I used to be a sales trainer, and in sales, you don't look at it as all these people are saying no. You look at your ratio of how many no's does it take you to get to a yes, right? So if people are saying no to you, no to you, no to you, if your legislators are not responding, that's okay, because every no gets you one step closer to a yes. You have to get through the no's to get to the yes. And I really feel like we got through our no last December. It was a big no, it was a hard no, it was painful no, but that's getting us closer to our yes this legislative session. And it really is all about building the connections and building the relationships. So before I open it up for questions, I did want to give a little bit of space and time for anybody who's introduced state legislation involving FASD to talk about what they're doing with that, if they'd like to. Because I know, for example, I believe Florida's got legislation, Washington State has legislation. I know North Dakota, my introvert friend there in North Dakota, has some legislation that he's introduced. Hawaii has introduced some legislation. Minnesota's introducing legislation. So we're going to try and get that all synopsized and put on the website for you. But if anybody would like to talk about how their legislation is going in their state, feel free to raise your hand or raise your voice.
Not all at once.
And if you're not ready, that's okay too.
I'll go. So in Florida, we're currently working on redrafting a bill that was shot down very quickly last year to add FASD as a developmental disability under our state recognition, so that we can potentially get our families some services. It's in the beginning stages. It has been refiled in both the House and the Senate, but that's where we are as of now here for that. So we're working on that.
Well, and Jennifer, let me ask, because I remember that. What were the objections? Were they primarily financial?
Absolutely, yes.
So
Yeah.
How are you addressing that concern?
That information has not been provided to me yet. It's the folks, the advocates that are teamed up with Senator Barnaby and Burnham are filling me in as it comes along. So I don't have a lot of answers to that question.
Yeah, because a lot of that, you know, it's in messaging and making sure they get the right message and how that can be addressed. So anyway, good luck.
Gotcha. So I see Kathy, Carl, and Barbara with hands up. I can go Kathy and then Carl and then Barbara, if that's okay. I wasn't sure what order they came up in, so I apologize if I'm out of ordering.
Thank you. Hopefully you can hear me. I have issues with my sound sometimes. I'm curious, I'm about to have a meeting with one of our local Kansas legislators for the state, not for DC. So is our goal to find someone who would be willing to champion this, help write the bill? Is there like a template that we could use so we could say after we, sell them on our journey and our cause? I guess that's where I want to go to is what are the steps as I meet with these people and hopefully, as we meet with them, hopefully, get them on board, then what?
That's a really good question. So thank you for bringing that up, because I think a lot of people get stuck on that when they're looking at state legislation. And so I know Barbara and Carl have both kind of gone through that process with legislation that they've worked on in their states. And so maybe instead of me kind of putting my 2 bits in here, Carl and Barbara, since you had your hands up too to speak, would you be willing to talk to that point on how you did that for you in your state? Would that be okay?
Ask me the question again. I'm sorry, I got a message. What was
No.
the question?
So the question was, you meet with your legislator and you get them on board with the cause. What next? How do you get them, what's the process for, at least in your state with your bill? Did you, and I know you worked with the group FASD now, but you were working on your legislation even before that. How did that process work for you? Did you write the bill first, or did you work with Senator Portantino's staff to draft something you knew they would support after they were signed on or kind of aligned with your cause? And Carl, if you want to step in here too a little bit on that, because I know both of your answers are probably going to be a bit different.
I'll wait until Barbara gets done.
When we started this, I didn't realize there was a state network. So we thought we were working completely alone. And so we found a sympathetic state senator who has a child with disabilities. And it was, I sat with him and I said, hey, Jim, what about doing this? And he looked at his aide, he said, this is a good bill. And that aide took off with it. And he was the one who produced the language. And then it languished. No matter how much we searched, my local little group we kept going. And then we found Annette in the group. And then it was putting all those heads together and people saying, I could try so-and-so and I could try so-and-so. And then that's when it happened. It was not one shot, it was a million shots. And it was, there was no ego involved. I mean, I think that's really important. Can you do it? Yay, go team, So it was a relentless pursuit of some pretty organized people. And I count Annette as that, and Annette can chime in here, that once we got a bite, we were prepared to go ahead. So it was the preparation piece and how to do that. So none of it was direct. It was all lateral passes until we got one that, as we say in California, the catch, which was a Joe Montana, Dwight Clark thing, the pass or whatever it was. So if Annette wants to chime in on that, she has some really good things to say. But Carl, I'm sure you have something that sounds similar.
Yeah, Barbara, I just add, we managed to build a kind of a Google Doc spreadsheet. We had built this big matrix of all of our assembly members and state senators. And we, through our various organizations across the state, we identified constituents. It's very important, we learned, when you're talking with the staff or your assembly member or senator, to have a constituent on the call. They
Mhm.
really listen to the constituents and are very sympathetic to their stories. And we did, and so in preparation, we built this big matrix, and then we just started, contacting these offices, and looking for a champion. And finally, there was a connection, and we got a senator who was very powerful. And that was really critical. And we had 3 really good constituents in his district that were very articulate and helped bring home how real this issue is. So I think, yeah, the group working together, working the phones. It was pretty hectic for a while, setting up all these appointments. And then we prepared, we scripted, we'd have preparation calls ahead of time. Who's going to be kind of the moderator? Who's going to hit this point? We got the constituent, prepared. No more than 5 minutes to tell your story. 3 to 4 is ideal. And then we went from there. So we drummed up a lot of support, and then we would identify the consultants to the committees to which it was assigned. So once we got it introduced, and then it's assigned to a committee, and then we'd find out who the consultant is to the committee, and we'd arrange a meeting with the consultant to the committee and find out, who else we needed to speak to. So it was a great learning process. We learned a lot, and we were very fortunate. And even until the end, we had to identify who the analyst was in the governor's office. Once it passed the Senate and the Assembly, we had to identify who in the governor's office was responsible for education. And then we needed to convince that person and their outside consultant that this was a worthy bill. So it does take a lot of effort, but it's definitely doable, and probably a lot easier in states other than California, which is such a big state.
I think too, what is important, and there's no one on this call who isn't part of some kind of advocacy group, but any kind of disability advocacy group that there is in a county, go there. And for me, I was just in a county meeting yesterday. Someone was retiring, and everyone there, the DA, the public defender, the chief, the probation chief, the sheriff, they all know when I am approaching them, I have FASD on my forehead, and I'm pesky and I'm relentless, and I will bend any ear, and I know that people turn around when they see me coming. So the beginning of that was, okay, she's going to talk about and able to say, public defender, well, you'll have, who's there, and they'll say, you bet I know who's there. So that's my 2 bits.
Barbara, there was a quick question before I have you go, Carl, was FASD already a developmental disability for waiver in California? Does anybody have a quick answer for that? And then we'll move on to Carl. Okay.
You're muted, Annette.
Yeah, we don't call it waiver in California, but no, it's not a definition in the developmental disability language, but we're working on that. I will just say briefly, we've drafted language to introduce legislation. We are looking for author of the bill. We're working our networks, our contacts for a sponsor. Our senator that championed us last year, unfortunately, this is his last year. So we're looking for others that can champion us. I'm not sure what he wants to do in his last year. They have not committed, but his office helped us draft the bill. And what we were asking for is the establishment of an FASD interagency coordinating body that would have representatives from the key government agencies on that committee, that would have an FASD coordinator. So we're trying to get that established in the state. But we don't have backing yet. We have about till February 17th to have the bill introduced. So we're working hard to get the appropriate author.
I think too, an important thing is that and this leaps over, the hard work it is to get the legislation passed, that a very well-known African-American psychiatrist here in California said, who is behind the Olympic Rights Project, he said, the details are not, the devil is not in the details, the devil is in the delivery. That the challenge now, is how the implementation pieces of it. It requires so much dedication all the way down the line too. So that's just the beginning piece.
Thank you, Barbara and Annette. I really appreciate that. And Carl, you've been camped out on your legislative critters spaces. So if you want to give an update on your work there in North Dakota, and then Marilyn, I do see your hand up. So after, as soon as Carl's done.
Our legislative session is biannually. We run 80 days, and we are, what, 21 days into this year's session. We started drafting legislation back in September. I personally wrote 4 of the 5 bills that we submitted to seek sponsorship. And we ended up getting a meeting with 5 key people on our Senate's Human Services Committee, and got the buy-in of all 5 of those people. And they're notoriously difficult when it comes to introducing anything new related to spending money. So those 5 bills were eventually combined into one piece of legislation that it's to add FASD to our developmental disability definition in state law, to add FASD under the special education categories next to autism, and to require screening of all kids going into foster care, and to require training of all foster parents for licensure or relicensure, and to establish a statewide FASD council. Everybody that I've talked to, except for the Department of Public Instruction, is on board so far, or at least they say they are. We do not have a hearing date yet, but I expect to have one, a date assigned to us for hearing by Friday. So, because changeover is where they cross the bills from the Senate to the House occurs in 2.5 weeks. So anyway, it's a lot of conversation. I spend half of every day sitting in the Capitol cafeteria talking to people as they pass. I am a registered lobbyist in my state, so I have to wear a badge and identify myself as such. Plus, I wear a lot of red shoe items. I don't know if you can see this. These are my red shoe earrings. This is my extra set. So everything I do, my attire all has to do with fetal alcohol. We also participate in legislative groups, working committees that talk about pending legislation and the hearings that are coming up. We meet with those people every Saturday morning for 2 hours. And if there's a bill comes up that I can anyway tie to FASD, I do so with presented testimony. Like this morning, there was an appropriations bill for $1 million for mental health awareness services. So I went and presented about how most people with FASD are diagnosed with all of these other mental health issues long before they get a diagnosis of FASD. So anything I can do to get a conversation started about fetal alcohol, I do that.
Awesome. Thank you, Carl.
Yes.
So very quickly, because we're at the top of the hour and I want to give Marilyn a chance to ask her question. And we're happy to stay on and keep going. I just want to be respectful of time in case Marilyn needs to go too. Marilyn, you had a question?
Can you hear me okay? I'm in my car on the phone.
Yes, we can.
Okay. Yeah, I wanted to add to what Jen had said about Florida, because I've discovered that my state rep for the state of Florida, and I'm in Daytona Beach right now, that he's 5 minutes away from me, that his father, and that he, like my father, both graduated from Stetson Law School, and that he is in more or less friends with the governor. And what I'm going to bring up is that if I move my son, who's getting extensive services because of his FAS diagnosis and low adaptive skills in Colorado. If we wanted to move him here, he would not even qualify. So that's my point. Now, the other point is that I think this gets into a touchy area, but the Parkland shooter would not have qualified for services, DD services in Florida. And I think that's something that I could also bring up because it's important for these people to get services. So, and I also want, I'll just add, since we're in a hurry, I really encourage everybody to get hold of whoever in your state deals, like Carl I think has done, that deals with mental health, and make sure they know about FASD. Luckily for me, my own state representative is an advocate for mental health. And she is working on a bill, which I'll be able to talk about once it's introduced, that she's adding FASD to the mix with mental health. And the more we can do that, I just really encourage people to do that at their local state level.
Fantastic.
That's it for me.
Thanks, Marilyn. And Carl, sorry, I had cut you off. Did you have anything else to add, my
I was
friend?
going to add just one more thing. And I was typing it in the box, but this will be faster. Our First Lady's platform is Recovery Reinvented. She herself is in recovery, and I am actively seeking a meeting with her and her staff. And from what I am told, that is next to impossible to achieve. And my argument there is nothing is impossible. So, yeah. And yes, I do call myself an introvert.
Well, I just put a link in the chat about if you're interested in tracking pending legislation. Pending legislation, you can always find, do a search on Bill Track 50 is the website. It's free, but that is only pending legislation. You might be able to get a couple of years back of what was introduced. But if you want to find out what legislation is currently active in your state, you're going to have to go through the, really go through the code. And that's a bit more of a deep dive. But that Bill Track 50 is just a good thing to kind of keep on your radar and have alerts come up if a bill is introduced that mentions fetal alcohol. Because, you know, as much as we want legislation to go through that is supportive of people living with this disability, we also want to be very mindful of legislation that might be proposed that would perhaps be detrimental to people with FASD or punitive towards women who may have an alcohol use disorder and might keep them from getting an FASD diagnosis for their kiddo so their kiddo can get help. So just something to be mindful of. But I want to thank you all for being here. I want to thank you all for your time today. Our next meeting will be February 22nd. That is 2 days after my 50th birthday for anybody who wants to celebrate with a donation to FASD United. FASD has been there around for 50 years. So have I. So if you'd like to do a donation to FASD United in honor of my birthday, I would welcome that. So have a great month. Sorry, what, Carl?
There's no way you're my age.
Probably older than you.
No.
It's all the filters on Zoom.
Yes.
All right, my friends, and please reach out. I'll throw my email in the chat. Please reach out if you have any questions.
And for those that have questions about state legislation, if I can answer them, I will. But be aware that I got my answers from other people in this group. So not to take away from them, but they have to speak up for themselves.
Fantastic. Have a great month, everybody.